Holistically Speaking. I am Morella DeVoe, your host. Today is our 100th show, for Holistically Speaking, and I am so happy to be hosting the show and to have as my guest Dr. Mike Stadtmauer. One of the things that I like to remind everyone at the beginning of every show is that our mission with Holistically Speaking is to be the avenue through which the voices of holistic health reach you at the time you need it most. And I am extraordinarily excited to have Dr. Stadtmauer with me because I know that we're going to be bringing a topic to our viewers that many of them may not have ever heard of before. And I think that you are working in a field that holds a lot of answers for people. So thank you for joining me and welcome on the show. Thank you for being the 100th show.
Thank you. Very excited to be here.
So our viewers, you may have seen in the title of our show that we're talking about the healing possibilities through functional medicine. So you are a naturopathic doctor and a practitioner of functional medicine.
Yes.
And my own curiosity, which I'm assuming might also be our viewers' curiosity, is what is functional medicine? And is it different from naturopathic medicine?
Sure. So functional medicine is, I would say, an emerging field. And there's a lot of people that have their toes in the water. And in the end, it's many different things for different people, I think. And so how I view it is treating people, approaching people from a standpoint of functionality rather than pathology. And recognizing the difference between the two, and that there is a continuum, that the human body is not a black and white thing. It's a thing of grayscale.
Yeah.
And so for many different conditions, for many different organ systems, in traditional medicine, it's kind of seen as this black and white thing,
Right.
where either things are functioning or they're diseased.
Right.
And you have one choice or the other.
Yeah.
But in reality, it's more nuanced than that. And there can be this continuum between perfect function and disease. And if the person falls into that continuum somewhere, a lot of times they fall through the cracks because testing is normal. They come up within normal reference ranges.
Right.
Maybe they're on one side of the reference range or the other, but they're still normal.
Right.
And so they're told there's no issue here.
Right.
But there is.
Sorry, and that as you were saying that, exactly what was popping to mind is that there's this range for diagnoses. And in traditional medicine, if you don't have a diagnosis, you're healthy.
Right.
And to meet the diagnoses, you need to be out of this normal range, right? But what you're saying then is somebody could be towards one end of the range or the other end of the range, and have not be feeling wonderful, but still be told that they're healthy or normal.
Absolutely,
right?
Absolutely. And in some cases, they can even be perfectly within the range, and things are still not functioning well because you're just not testing the right stuff.
Yeah.
So, for instance, thyroid. Before the show a little bit, we're talking about thyroid. And you can have a situation where the standard tool for thyroid testing, which is called TSH, the TSH test, is very perfectly normal. But when you dig a little deeper and look at the levels of circulating thyroid hormone within the body, those can be significantly off.
Right.
And it not be reflected in that TSH level, which is typically all that's tested. You know, most people have a screening, that's all that they look at.
And so what you're saying is something I've also seen in my own practice, where sometimes someone might have all of the signs and symptoms of hypothyroidism, but they get tested and they say, no, you're normal.
Right.
You don't fit the diagnosis, so you don't get the medication, but this person goes away and they're still feeling terrible, right?
That's right, exactly right.
So what you're saying then is that you work with people even if they don't fit a diagnosis. What do you do?
Sure. So many times we're able to, through laboratory testing and through going a little bit further than the norm in terms of what's looked at, we're able to demonstrate that this person has actually some deficiency or some abnormality in something. There's this concept of reverse T3, which is this kind of bad form of thyroid hormone that the body can produce, which blocks the functioning of normal thyroid hormone. And so you can see a situation where everything is normal, all the thyroid testing is normal, except they have high amounts of this kind of blocking hormone. And so at the cellular level, things aren't happening correctly.
Right.
But that's not reflected at all in the normal testing. So that's one situation. Another situation is they have very perfectly normal testing, but when we look at like their body temperature, or we look at the the totality of hypothyroid symptoms, they fit the picture very well.
Right.
And there's certainly this growing movement, which is embraced by the functional medicine community, of treating based on symptoms and based on the clinical picture, and not necessarily relying solely on the laboratory analysis.
Yeah. So when someone comes to work with you and you are able to assess that they fit, for example, this hypothyroid picture or whatever other need for support that they have, whatever other symptoms or other ailments or whatever it is that they're presenting with, how do you work with them? Because are you prescribing medication? Are you what are your tools?
So ultimately, it's all about whatever the patient needs, and whatever is needed to get them where they want to go, or at least moving forward. And so, as a naturopath, my preference is to try to stimulate the body to do what it needs to do. And then there's also this major concept in naturopathic medicine called removing obstacles to cure. And this fits very much into the functional model, where there's no pathology present, their tissues are fairly normal, like for instance in functional gastrointestinal issues, IBS, which is something that I work a lot with. And in IBS, the very definition of it is that there is no pathology, that everything is normal on imaging or on testing in some way or another. But certainly, the proper functioning is not there.
Right.
And so there's something that's impacting that tissue that is not allowing that tissue to do what it wants to do.
Right.
And so removing that obstacle sometimes is all that needs to be done, and then the body's able to move forward by itself.
Okay.
So that's a big part of what I do, is to try to identify why this organ, this tissue, whatever, is not functioning correctly. If we can identify that. Sometimes we can, sometimes we can't. So
I'm trying to imagine what are some of these obstacles that you might be removing.
Yeah.
Are there some common obstacles?
Certainly. So in keeping with IBS, food intolerance is something that I talk about every day, that I see impact people's GI systems in an enormous way. So for instance, just to pick out one, dairy foods. The most common symptom of dairy sensitivity is constipation. And so one option is to throw laxatives at a person to try to get them on this drug or that drug, or this drug for IBS with constipation or whatever, and just treat that symptom. But perhaps a better approach, in my opinion, of course, is to try to allow the system to work normally by removing what is not allowing it to work normally. And in that case, it would be dairy. And in many cases, when dairy is the issue, it's quite profound, the difference between being on and off of it. Right. So that's one example. Yeah. Another example is the organisms that are impacting the GI system. So maybe the tissues are all very normal, but the organism balance is not normal, is pathologic, and we call that dysbiosis, or imbalance between good and bad things living in the gut.
The internal flora, you mean, is like out of balance.
Yeah, absolutely. Okay. So maybe they have an overgrowth of this or that bacteria, or yeast, or they have too much bacteria within their small intestine, or something like that, that is impacting their system, that's not allowing their system to work properly. And if we address that, then everything moves on.
And how do you assess that?
There's a number of different ways to go about it. So there's a stool testing is something that I do a lot.
Okay.
I find that to be very valuable, in, especially with working with IBS patients. And it's important to understand, I think, what exactly is living in the gut, and that's very helpful. There's breath testing that we do for bacteria in the small intestine. There's blood testing that we do to look at food sensitivities, and if their body, if their immune system is highly reactive to this or that food.
Oh, wonderful. So it sounds like you do a lot of data gathering in terms of...
Very much so.
Okay. So you do stool testing, blood testing, food sensitivity testing, all of this stuff. And so you're talking about removing obstacles is one tool. So removing, say, for example, offending foods, or helping to rebuild intestinal flora. So I'm curious to seeing what other tools do you work with that people might expect to see you using if they work with you?
So sometimes that approach only gets us so far, and we have to kind of help things out a little bit. And so we can do that through herbs, we can do that through supplements, botanicals, as a naturopath, which is not necessarily a part of functional medicine per se. You know, you asked about the difference between functional medicine and naturopathic medicine.
Yeah.
And I think that there's a number of differences, but a big one is a focus on herbal and botanical medicine, which is very much a focus of naturopathic medicine, and not necessarily a functional medicine, but it can be.
I see.
So through the use of these herbs or botanicals or supplements, whatever word you want to use, we're often able to improve the functioning of certain organs or tissues or systems or whatever it is we're working with.
I see. So then there are functional medicine doctors who are not naturopaths and might approach things slightly differently?
I would say the majority of people who are calling themselves functional physicians or functional practitioners are not naturopaths.
Oh, okay.
Yeah.
And so once they do all their data gathering and the testing, and they identify the obstacles, or I guess what you're all looking for is the cause of these issues, right?
Absolutely.
And addressing the cause as opposed to symptom suppression, which tends to be what we normally get through taking medicine, right?
Yes.
So in functional medicine, once you do all that data gathering, then you're looking to address that cause.
Yes, right. It's all about, I do rely a lot on laboratory medicine, and that's an enormous part of my practice. I honestly don't know how to do it otherwise.
Yeah.
And I often talk to people about, I use that phrase, data gathering, quite often, and throwing out this kind of big net and seeing what comes in.
Right.
Especially with people that have been through the ringer, that have seen 3, 4, 5 different doctors and specialists and still have the same symptoms going on. Maybe it's just a matter of widening the scope of what we're looking at. So yeah, laboratory medicine is a big part of what I do.
Yeah. So I'm really wanting to present to people who might be watching this, who might be the perfect person who so needs your help. What are some of the conditions or syndromes or diseases that you either specialize in or that you love to work with because you see incredible improvement? Who are those people that need to come talk to you?
So IBS, irritable bowel syndrome, is something that I think is tailored to the functional medicine approach. It's something that has stymied modern medicine, and we've been essentially unable to come up with an effective drug. And it's because there is no single cause. There's no single IBS patient. Everybody's different. Maybe for one person it's a food issue. Maybe for another person it's a bacterial issue. Maybe for another person it's because they were exposed to some chemical or toxin a while ago, or whatever the case is. And so the functional approach is an individual approach, and so that condition is tailored to it. Generally, fatigue. You know, fatigue and insomnia are issues that affect a lot of people, and especially fatigue. There's not a lot of attention paid to fatigue, and a lot of times people are brushed off when they come in with that complaint. But there's many different reasons that people could be fatigued, and it's not often that difficult to figure out. Maybe they're anemic in some way. Maybe they have some blood sugar issues. Maybe it is an issue with their sleep. Maybe their adrenals are not functioning correctly, whatever the case. So those conditions, and endocrine issues in general, thyroid and adrenal and dysfunctional menstrual cycles, all respond very, very well to this approach.
That's really exciting to hear, because I find that so many people are struggling with some hormone issue or another, and those situations can seem really confounding and difficult to shift, right? That it's just hypothyroidism, or borderline hypothyroidism, or menstrual issues, and
right. And a lot of times I think it's because that the person is not being looked at as a system. The person is being looked at as a hypothyroid patient.
Yeah, as one organ.
Right. This thyroid is not functioning correctly, so let's treat the thyroid.
Right.
But maybe the thyroid isn't functioning correctly because of the impact of the adrenals on the thyroid. Maybe it's not functioning correctly because of, again, some blood sugar issue or toxin issue, whatever the case. And so endocrine issues especially respond much better when we look at the whole picture, when we look at the interaction between the different endocrine organs, and understand how they fit together.
Wonderful. So you have endocrine issues, IBS issues, fatigue, insomnia. Do you have any special stories of individuals that you can tell us of, it's like sometimes hearing the story of someone who did really well really brings it to life for someone.
So I guess one that comes to mind is a woman who had very significant irritable bowel issues for many, many years. Mostly characterized by significant bloating, very painful, and again, it's somebody who had been to many, many different doctors, doctors in Boston, doctors at Dartmouth, and was just told over and over again that everything is normal. We can't find anything wrong. After we did some stool and breath testing, we figured out that she had this overgrowth of bacteria in her small intestine, which is a relatively newly recognized issue and discussed issue, this issue of SIBO, what's called SIBO. And within 2 days on the treatment for it, she felt like a new person after decades of having these symptoms.
And I'm sure her life is completely different.
Completely.
From experiencing that.
Absolutely.
And experiencing the relief from that.
Right.
So, given that there seem to be so many things that just a few decades ago were somewhat rare, and now we hear of so many people with hypothyroidism, with polycystic ovaries, or menstrual cycle problems, or IBS, or chronic fatigue, or adrenal fatigue, like all of these conditions that just we never heard of and now seem so prevalent. Is it that we're hearing more about them because there's an awareness, or do you think that they have been increasing?
A lot of people would say that it's just increased awareness, but the numbers tell a different story. And for instance, with gluten issues and celiac disease specifically, there have been studies done that have shown that there's a 4-fold increase, at least, in the incidence of antibodies to gluten within the human population over the last 40 years or so, which is a tremendous increase in a small amount of time.
Yeah.
And it's because of our environment and a lot of times what we do to ourselves. Right. But it also has to do with the quality of our food and the makeup of our diet, and the toxins we're exposed to, and all of these things coming together to create the situation.
Yeah, so, and it's funny because that was exactly what I was going to follow. My next question was going to be, are there some of these things that systemically or environmentally are creating a variety of different issues, like gluten? Are there other things that you see might be causing, contributing to IBS over here and hypothyroidism? Do you see what I'm asking? Are there these kind of umbrella issues that we are dealing with in greater numbers, or no?
Well,
is that a weird question?
I think that I would answer that with gluten. Gluten, I think, is the single thing that would affect most people in that way. And we have a relatively new understanding of it causing many issues outside of the GI tract. Right. So it can be related to asthma and eczema and migraines and fatigue. The number one presenting complaint of people with gluten issues and celiac disease is fatigue, not digestive issues, not anything like that.
Yeah.
So it's the realization, I think, of how that can impact the body.
Yeah. And it's interesting because I've noticed with gluten personally, and I don't necessarily avoid it entirely, but I've noticed for me what I call my little gluten depression, that when I eat a little bit more than, or indulge more than I typically would, the next day I can notice just like this subdued feeling of like dullness, that I'm just not as excited about life for no reason, other than this kind of sluggishness in my body. So we were actually talking about the possibility of doing another show on gluten, so I think that we'll have to share that with viewers, that we will have you on the show again so that we can dive into this topic, because I think a lot of people are hearing about gluten and celiac, and is this real or not, and what does it mean, and should I be avoiding gluten? So I think it really has a lot of merit.
Yeah.
There was also something that you just said a few moments ago about the things that we do to ourselves and the environment around us that can be contributing to this increasing trend of all these conditions. What are those things that we do to ourselves?
So we can create situations where the stress that we're under becomes very detrimental. I often, when I'm talking about the adrenals, which is our stress glands, I often say that they weren't built for 21st century America. Yeah. That they weren't built for this kind of constant go, 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 stress, stress, stress lifestyle that many of us lead. Right. Here in Vermont, we try not to do that, but in other places. So that's one thing that we can do to ourselves that ultimately can lead to some harm. And then diet itself, I think, is the single biggest thing. The standard American diet, very high in sugar, very high in simple carbohydrates, is ultimately destructive.
Yeah, yeah, it's certainly not food that typically comes from nature. The majority of the stuff that we're eating, it's like not coming from gardens. No. I like to think of Michael Pollan's really simple maxim: eat real food, not too much, mostly plant. You've heard that. So before we're out of time, I want to be sure to show our viewers how to reach you and get in touch with you, and also because you have a wonderful class coming up in a couple weeks. So we could show that information. So your upcoming lecture is IBS, or How I Learned to Stop Bloating and Love My Gut. And that's Thursday, July 17th at 6:30 in the evening at Healthy Living. So I assume that's in their learning center at Healthy Living. Do people need to sign up for this, or?
I think it's best, but they don't need to.
Okay. And so you're going to be talking essentially about IBS and
all the different things that I find, as we've talked about a bit tonight, that impact the bowel and finding causes. It's all about finding causes. Absolutely.
Wonderful. And then the other slide that we wanted to show our viewers is the two websites on how to find you. So you can reach Dr. Mike through vermontfunctionalmedicine.com or also through naturopathicvermont.com. And naturopathicvermont.com, that's your practice, is
That's
that
the
right?
clinic website.
The clinic. And Vermont Functional Medicine is your own
It's kind of my personal website, yeah, to share more of what I do specifically.
And your philosophy and your
Yes.
approach, et cetera.
All of that.
So I believe we have only a couple more minutes left. Is there something that we haven't touched on that you feel needs to be said, or something that needs to be reiterated?
So one of the ways of understanding functional medicine is through this tree analogy, which the Institute of Functional Medicine, which some people think is the kind of authority on it, this is what they use on their website, and I think it's very helpful. So it's the idea of, essentially in medicine today, we're treating the branches. We're treating these symptoms. You know, we're addressing whatever the person is presenting with on the surface. But underneath that, in the root structure and the trunk is really where the issue stems from. And so by addressing those basic things, looking at basic blood work, looking at the basic functioning of their organ systems, you know, we can often affect change in the branches without actually even addressing them.
So a tangential question, based on my own philosophy, do you ever look at the emotional component of some of these things? You know, you mentioned stress. Do you look beyond stress as, you know, the emotional links to some of these conditions?
Yes, that comes up. I can't honestly say that's my strong suit.
Right.
So
what, you don't do everything?
You know, if I feel that is a piece of the picture, then I will absolutely encourage the person to get the help they need, and in order to move forward.
Yeah, as a kid, my mom took me to a homeopath in Venezuela, and this always stuck with me, that he said all diseases and all conditions enter the body through two avenues, through the mouth or through the head. And I thought that was always so interesting. You know, so you've shared so much with us in terms of the different people who you especially see functional medicine working well for, the IBS people, the fatigue people, insomnia, hypothyroidism, or other hormone disorders. Am I leaving anybody out?
Well, we didn't mention, but chronic inflammation, autoimmune conditions, I think, I know, can respond very well.
Wonderful. I almost feel like I still want to ask you more about chronic inflammation. And when you mentioned fatigue, I thought, do you mean chronic fatigue? So we could almost have that also on our next show, and maybe touch on some of that. So thank you so much for joining me.
Thank you.
And thank you for joining us on our 100th show. I hope it was as interesting for you as it was for me. It's certainly opened my eyes in terms of what's possible with functional medicine. And I hope you'll join Dr. Mike at Healthy Living on July 17th to learn more about IBS, or visit his website to see how he might help you in your specific condition. Thank you again for joining me, and I will see you next week.